All right. Good morning, everyone. My name is Allison Nelson. I'm the Vice President of Community Impact here in the Greater Charlotte area. We want to welcome you to the topic today is tips, tricks, and tools for building stronger communities in North Carolina. I am your host today for the virtual conversation, and I want to thank you for joining us early in the morning. We gather here today not to just discuss the science-based guidance for a healthy life, but to celebrate the great efforts and innovations happening right here in our communities. Heart disease and stroke remain the leading cause of death in men and women in the U.S. In the face of these continuing chronic diseases, our commitment to the work remains unwavering. Today, we have a lot of experts, community leaders, stakeholders to share some information on heart health. We're honored to have a distinguished panel of presenters bringing unique expertise and passion to the discussion. We're going to talk today about some valuable insights to this crucial cause. Our event is powered by Novant Health in collaboration with American Heart Association. Thank you, Novant Health, for your support of this virtual event and other ways you're providing engagement opportunities aligned with the community's need. Our work together helps expand AHA's mission to be a relentless force in a world of longer, healthier lives. We are thrilled to be the presenters today, American Heart Association. Let me welcome Jen Graziano, Senior Community Impact Director of the Triad Market, Kat Combs, VP Community Impact Triangle Market, and Dr. Ashley Carmenia, Community Impact Director of the Greater Charlotte Market. Next slide. Okay, a couple of housekeeping items to start us off. We are recording today's community conversation. There is a Q&A icon in the Zoom platform available for you to type your questions in. We would love to hear from you throughout the whole webinar. At the end of each speaker's presentation, they will answer as many questions as time will allow. If we do not get to all of the questions, we will have a follow-up email sent out after today's webinar. And we'll go to the agenda. As you can see, we have a full agenda for the hour and a half with multiple topics. We're going to begin with Life Essentials 8. It's a set of science-based key health behaviors and health factors developed by the American Heart Association to help individuals improve and maintain cardiovascular health. I'm going to pass things off to get started with Jen Graziano.
Thank you, Allison. Life's Essential 8 is the American Heart Association's framework for improving and maintaining cardiovascular health. It reflects the latest science on heart and brain health and focuses on the key factors that have the greatest impact on heart health and overall well-being. The American Heart Association developed Life's Essential 8 to simplify what can feel like a really complex topic, heart health, into practical, actionable areas people can understand and improve. At its core, Life's Essential 8 is a checklist of the 8 areas that help us understand how healthy our heart and bodies are and where we can make improvements. It's designed for people of all ages, helps track health across the entire lifespan, and provides a clear, measurable way to assess risk and progress. These 8 components are divided into 2 main categories: health behaviors, what we do every day, and health factors, what we can measure inside our body. Life's Essential 8 reminds us that health isn't just about one organ or one habit. It's about how the mind, heart, and body work together as a system. Factors that affect one can affect the other 2 positively or negatively. Improving Life's Essential 8 isn't just good for your heart, it's also good for your overall well-being. Let's break down the 4 key health factors. These are the measurable clinical indicators that reflect our overall cardiovascular health. These numbers can give us early warning signs. They help us understand risk before serious conditions like heart disease or stroke develop. Let's take a closer look at each of these 4 health factors, starting with blood pressure. Blood pressure is the force of blood pushing against the walls of your arteries. Healthy blood pressure keeps your arteries working efficiently. Uncontrolled blood pressure quietly constrains the entire cardiovascular system without you even really noticing. Another important health factor is your blood lipids. They are a key health factor because they show how well fats are being managed in the body and how healthy our blood vessels are. The main focus here is on non-HDL cholesterol, or LDL cholesterol, which is often referred to as the bad cholesterol. Next, maintain a healthy weight. Healthy weight isn't just about appearance, it's about reducing the strain on your heart and lowering risk across multiple health factors. The last health factor is blood sugar. Chronically high blood sugar can lead to diabetes. Uncontrolled diabetes damages blood vessels and nerves, increasing your risk for heart disease. But here's the key. These factors don't exist on their own. They are strongly influenced by how we live every day. That's where the other half of Life's Essential 8 comes in, the 4 health behaviors. These are our daily choices that we make that can directly shape these numbers. I'll pass it over to my colleague Kat for the next part of the presentation.
Thanks, Jen. So we're going to talk a little bit more today on those 4 key health behaviors and how we can improve these health behaviors. So we're going to talk a little bit about not smoking or vaping, adequate sleep, healthy diet, and physical activity. Let's start with improving your sleep. And to be a little bit interactive today, we want to have you drop into the chat whether or not, and I missed the question. You already know the question that we're asking, is, are you getting enough sleep? Sleep can change your routine even on the weekends and can lead to serious sleep problems. So we want to make sure that you are getting enough sleep during the day. We want to make sure that you can improve that sleep. And we want to share with you some ways that you can do that. It may be, if you're not getting enough sleep, it may be much harder to wake up early on the mornings. Your sleep can be disrupted, and the circadian rhythm can also mean that you're getting shallow, fragmented, and lower quality sleep. And women typically who spent 2 or more hours catching up on sleep over the weekend are more likely to have poor cardiovascular health. So getting enough sleep can lower your risk of chronic disease and type 2 diabetes. It can also strengthen your immune system, improve your mood, and increase energy, and make you more creative. So let's talk a little bit about what you can do to get enough sleep. If you're adding more daylight into your day, you can add more movement into your day, or you can just be consistent with what you're doing to maintain that sleep. Most adults need at least 7 to 8 hours of sleep each night, including weekends. Natural light exposure during the daytime and regular exercise makes it easier to fall asleep. And consistency. Go to bed and wake up at the same time every day, weekends included. Let's try to get less of this. Nighttime activity. We all know that we look at our phones quite a bit. Heavy meals, alcohol, nicotine, and caffeine can also have impacts. And evening screen time. Take care of that digital well-being. Set do not disturb times on your phone. Try to go to bed. Set that alarm. Keep your screen time in check. I think that's one of the more important ones that we can emphasize today, is just really reducing that screen time right before bed. It certainly helps you wind down with other techniques too, whether that's meditation or relaxation techniques. Let's talk about improving your diet. So, true or false? When it comes to getting your fruits and veggies, fresh is always best. I'm going to go with false. And we're right on that because a healthy diet can include fresh, frozen, canned, or dried produce. It does not always have to be fresh. There are benefits in having any of these types of fresh fruits and veggies, just depending on how you prepare them. Rinsing some of those canned fruits and veggies can certainly make a difference for the syrups that are included, and always looking for no added sugar or sodium is a major benefit. So the benefits of improving your diet: a heart-healthy diet can lower your risk of heart disease and stroke. Fruits, veggies, grains, omega-3 fatty acids, and lean meats can keep depression at bay. Fruits and veggies are linked to higher levels of happiness. I do notice that when I eat some fruits, that I get a little boost of energy. So what can you do to improve your diet? Try adding more of those fruits. Aim for more whole grains, plant-based proteins, and some surprising sources of plant-based proteins, which we don't always think about, are foods like tofu, quinoa, mushrooms, beans, legumes, nuts and seeds, artichokes, asparagus, broccoli, Brussels sprouts, collards, corn, potatoes, peppers, spinach, sweet potatoes, and turnip greens, and many, many others. Lots of vegetables, always consuming vegetables. There's always a benefit in having lots and lots of vegetables and those plant-based proteins into your diet. And let's try and get a little bit less of added sugars. You can watch out for added sugars and sodiums, which can be hidden in a lot of unexpected places. You can also try and limit the consumption of alcohol, refined carbohydrates, full-fat dairy products, and tropical oils like coconut and palm. Highly processed foods typically contain things that you wouldn't use in food preparation at home: colorants, flavorings, modified starches, high fructose corn syrups, etc. And then some of those high processed foods include things like packaged chips, cookies, white bread, packaged pasta, frozen pizza, energy and protein bars, sweetened breakfast cereals, baking mixes, and instant soups. Let's move on to improving activity. In our third health behavior, so true or false? To get enough activity in your day, you need to work out. I'm going to go with false. All movement counts and can boost your health. You can even break it up over the day. The word exercise can make us think of traditional fitness activities like running or hitting the gym, but it's all important to remember that any of your movement counts. Thinking about physical activity can just mean that you are moving outdoors, doing things around the house like household chores, but any of that movement counts, and it is all worth it. The benefits of moving more: it floods your brain with feel-good chemicals and improves the mood. Weekly exercise boosts your immune system, can lower your blood pressure, reduce your risk of heart attack and stroke, and control blood sugar. And it can also improve sleep. So you can kind of see how we're tying them all together. They all have benefits depending on which one you're thinking about, and we want to make sure that we're leaning in with all three of those. So what can you do more of when it comes to physical activity? Try to add more mini breaks, get some fresh air, and go play. You can start small, even if it's 15 minutes. Eventually, you can build up to 150 minutes per week. Yard work, dancing, walking your dog, cleaning your house all count as movement. raking leaves, the vacuuming, anything that's a household chore that we don't always love to do, but we do them to maintain, those are all considered a form of a physical activity. It requires you to be up and moving and doing things that you wouldn't otherwise be doing in a traditional workout setting, but physical activity is so important. And try and get less of this. Sitting at your desk, sitting on a screen, and be with others. Try and stretch between meetings and move while you binge watch TV. Take the stairs when you can. So we want to make sure that we are doing things that are just small things that don't have to always include others that are around us and keeping us accountable. We can do these things on our own. We just want to make sure that we are getting activity in our days. Our last of health behaviors is quitting nicotine. So true or false? Nicotine helps you relax. Some might say true, but that is false. It can increase stress levels and trap you in a cycle of addiction. In a Truth Initiative survey, young people who quit vaping found that 90% of those who quit vaping said they felt less stressed, anxious, and depressed. Nicotine certainly has those addictive properties, and we want to make sure that we're not leaning in on some of that unhealthy behavior and becoming addicted to nicotine. So the benefits of quitting. 1 year after quitting, your risk of heart disease goes down by half. You'll increase your chances of living longer. Your sense of smell and taste will improve. Your smoker's cough will go away. And on average, smokers die more than 10 years earlier than non-smokers. Vaping is a huge threat to kids and young people. Tobacco companies want to hook a new generation on nicotine and smoking. They've spent more than $8.6 billion on aggressive marketing alone, and that's almost $1 million every hour. So what can you do to quit nicotine? A buddy support system and program can help you with some of those common struggles of quitting. You can stay active. Being physically active can help you manage the stress and the cravings when you are quitting, and you'll feel better too. And the goals. Quitting takes a lot of willpower. Reward yourself when you reach milestones and forgive yourself if you take a step backwards. Getting back on course as soon as possible to stay on track and kick off the good habit is for your own good. And let's try and get a little less of those emotional triggers like stress and anxiety. So quitting can be tough because there are so many triggers that remind you of smoking. So avoiding those emotional triggers, those social triggers, being around groups of people that smoke, and situational triggers, parties, concerts, or places that you associate with smoking. And if you just don't know where to start, because we covered a lot and that can feel really overwhelming, just remember it's all connected. Your mind, your heart, your body, it's all connected. We're all connected in that way. Each one of us is built the same when we come with our minds, our hearts, and our bodies. And just remember that it's all connected, and don't overwhelm yourself with trying to make all those changes at once. We want to encourage that you do those in small doses and take behavior change seriously as you continue to aim for those goals. You can start a positive chain reaction, and something as simple as moving can spark a positive shift. You don't have to make big life changes just to see the small benefits. Just add a little bit more activity into your day and take those things one step at a time. And when you do start moving, it's a more natural mood booster. Regular physical activity can relieve stress, anxiety, depression, and anger, and they don't all have to happen at once. I appreciate you listening to this today, and I am going to pass it back over to Ashley for our community-based panel organization presentations.
Right. Thank you so much, Kat and Jen. Definitely appreciate you guys covering our Life's Essential 8. So, good morning, everyone. I am Dr. Ashley Carmilla, and I'm so excited to serve as your moderator for what I know will be a great conversation with some great panelists that we have this morning to join in on our conversation. So, to get us started, I'll invite each of our panelists to briefly share more about their impactful work in the critical areas that are moving the needle on community health. Their brief presentations will be followed by a conversational exploration of key barriers to health in our community, as well as partnerships that are driving meaningful impact, and then practical ways to promote healthy behaviors that resonate with the populations in which we serve. I'll get started by introducing and providing a brief background on each of our panelists. So this morning we have joining us Dr. Ahuna Freeman, Patrick Garcia, and Megan Hutchins. So first up, I have Dr. Ahuna Freeman. Dr. Freeman is a Nigerian-American pharmacist and entrepreneur with a passion for transforming community healthcare. She earned her Doctor of Pharmacy from Campbell University College of Pharmacy and Health Sciences in 2009. Go Camels. I'm also a Campbell alumni. Following undergraduate studies in chemistry at the University of North Carolina at Asheville. Dr. Freeman transitioned from corporate pharmacy to independent ownership in 2014, co-founding Southside Discount Pharmacy with her husband. She further expanded her impact by establishing Align Care LLC, a healthcare company dedicated to promoting preventative care, as well as team-based patient care. Dr. Freeman is a respected advocate for health and wellness, both virtually and within her local community. Her expertise lies in preventative care, clinical pharmacy services, patient education, and fostering collaborative relationships between pharmacists and other healthcare providers to improve patient outcomes. Next up, we have Patrick Garcia. Patrick Garcia is a writer and dedicated advocate for the Latino community in Charlotte, North Carolina. With a strong focus on education, mental health, and social support services, he is the founder and executive director of Embrace All Latino Voices. He also serves as a board member at Enlay Charlotte, a nonprofit organization committed to empowering the Latino population through comprehensive social support and cultural recognition. In addition to his board role, Patrick Garcia is actively engaged in academic and professional development, with him serving as a researcher in the Department of Education at the University of North Carolina at Charlotte, UNCC, and is currently pursuing graduate studies in the counseling department at UNCC as well. Patrick's commitment to advancing health equity has been recognized by esteemed organizations, as he was honored by the American Heart Association for his contributions to promoting health equity within Latino communities. And then we have Megan Hutchins. Megan Hutchins is the Senior Director of Development at Good Shepherd Center, where she supports the organization's mission to feed the hungry, shelter the homeless, and foster transition to housing. With 18 years of experience serving low-income communities in Wilmington, she is passionate about advancing solutions that connect food, health, and stability. Her work helps strengthen Good Shepherd's effort to address food insecurity through programs like the Soup Kitchen, Second Helpings, Grocery Giveaway, and meal delivery for vulnerable neighbors across the community. So I thank you all for joining us this morning. Up first, we're going to hear from Patrick with Embrace All Latino Voices. So Patrick, I will turn it over to you.
Thank you very much. Hello, everyone. I hope we are all having a great morning with so much great learnings here as well. So I'm Patrick Garcia, from Director of Embrace All Latino Voices. We serve statewide North and South Carolina in 4 departments, including addressing the social determinants of health and health access. So what makes us different is that besides helping the Hispanic community, the people that speak Spanish as first language, we are also Lusophonics, so we speak Brazilian Portuguese, and Francophonics, we speak Haitian Creole. So we can basically address and help any individual from Latin America in their for the perspective of trauma-informed and national trauma-informed health. So in the partnership that we have with the American Heart Association, in 2023, we established a health station at our organization. And since May of 2024, we have do the assessment, and we have taken and we taught our Latin communities how to use the blood measure, the self blood monitor machine, and also glucose readings. So we have more than 1,500 readings, and as we expected, almost 20% of our population had an abnormal reading on site at the moment. And as part of this of the partnership that we have with Atrium Health and also with Novant Health, they leave our office at the moment with an appointment to see the doctor no longer than 6 days. Also, if they don't have means to buy a blood pressure self-monitoring machine, in partnership with the American Heart Association, we received 50 devices that are lended to them and they can use for up to 3 months. So through this process and the approach that we use, our surveys shows a nearly 100% of the population saying that they better understand their blood pressure and that they can use uh, at all or way better the equipment. And I'm here talking about populations that 66% do not have health insurance, and that almost 56% didn't have enough to eat in the last 30 days, self-reported. So it's a population very in an area of vulnerability with very limited resources, and the knowledge that Embrace helps in partnership with the American Heart Association makes the difference in all 4 languages and also empowering peer support. So living from inside the doors of our and walls of our organization to the communities where they live. And for that, I'm going to pass back to Ashley and expressing our gratitude, not only to the American Heart Association, but to every single one of you that identify and that fight in your communities to be a champion of this cause. And you guys can see here on the screen a little bit of the volunteer community that we do, the maternal groups that we do, the living activity, and also nutrition and food insecurity programs. All of those thanks to American Heart Association and their partners.
Wow. Thank you so much, Patrick. Definitely appreciate that overview and insight into the work in which you guys are doing and those statistics. So now I'm going to pass it over to Dr. Freeman to give us some insight into the Southside Discount Pharmacy.
Absolutely. What beautiful work you do, Patrick. That was good. But good morning, everyone. I hope everyone is enjoying their morning. I am Dr. Huna Freeman, and I am the owner of Southside Discount Pharmacy. We are here in Winston-Salem, North Carolina. So we're in the Triad area. We are an independent community pharmacy, and in our community, we are committed to preventative health and patient education because we are very accessible to the community. So most of the time, when patients come in with a concern that's health related, they come in first to see us to get guidance on where they should go next. And here in the picture, what you're looking at is our blood pressure stations that we have available in the pharmacy. We use it quite a lot of time. And not only do we do extensive patient education around those Life Essentials 8, because we know those are the path towards preventative care, we also dispense medications as a pharmacy. So we really try to tie in the patient education along with the dispensing in order to prevent something catastrophic down the road. So here I wanted to share just a real patient example. And I love this story. My staff and I, the whole team, we talk about this story a lot because it's one of those stories that really can be anyone in this current stage, like this, in this era of digital, information or misinformation, as you may say it. So here's the story of a real patient. We have a 48-year-old male was diagnosed with new blood pressure diagnosis and only put on 2 medications. Well, one of the obstacles that a lot of our patients, not just him, face is first, you have the medication hesitancy, and then you have social media with so many stories or with so many opinions. So it gets very difficult for patients to be able to distinguish the right versus the wrong, which is very normal for us. So this patient started off with being hesitant with the 2 medications that he was put in, and opted in to actually try out what he had seen in social media. And in this time, it was apple cider vinegar. So what he did was he discontinued his medications and really started taking the apple cider vinegar every morning. Now, there's nothing wrong with this, and there's no judgment in this case, but where the ball was dropped, and that's why I have the picture, is the monitoring aspect of it. So if the patient was truly monitoring his blood pressure, he could have at least been able to know if the route he was going was helpful or was it being hurtful. Unfortunately, that wasn't the case. So he wasn't monitoring as we would have liked for him to do. But what eventually happened is he ended up suffering a stroke, which made him unable to maintain any normal activity of daily living. So his medication actually went from just 2 medications to 21. He stayed in the hospital for for a long time, went into rehabilitation, came home, and then went under the care of his parents, essentially. So that's when we met the patient. And this story told by the caregiver is something we like to bring to our patient population's attention, because the medication hesitancy is real. Health information or health misinformation is also real. But how we try to neutralize that is through evidence-based patient education and really trying to guide the patient and actually embracing them to come forward with those questions. Because when the patients trust you and you're able to show them how you're processing a thought or why they should or shouldn't, that really changes the trajectory of how they manage their care. So this is exactly what we do here at Southside Discount Pharmacy. And we do this for blood pressure, for blood lipids, and blood glucose. So it's a station that we have at the pharmacy for everyone in our community. We have a high population of Spanish speaking and English speaking. So we always have a staff that's able to communicate to patients in the way that can speak to their heart directly. So we provide a judgment-free counseling to help patients navigate the information that they receive before they determine if the pharmaceutical way or the home remedy way is the way to go. And even if they can combine both, what they should watch out for and what they need to monitor. Every single member of our staff have been trained on the technical support on how to help patients with monitoring, or whether it's self-monitoring for blood pressure or checking their blood sugar and understanding the time and why the timing is important for proper reading. So beyond dispensing, we also do other things like blood pressure. We also do delivery and packaging to help patients not be overwhelmed with the chronic conditions that they may be managing. So that's what we do here in our community in Winston-Salem. And I appreciate all the support from American Health Association, because you've been very helpful in helping us help our own community in preventative care. Thank you.
Thank you so much, Dr. Freeman. It is always interesting and enlightening to see the different touch points in which, people they walk into, especially as it pertains to their healthcare, and are able to receive holistic wraparound care. We are now going to move to Megan. So, Megan, we will hear about Good Shepherd, the Good
Good
Shepherd Center.
morning. Yep, thank you so much. For anyone who doesn't know us that well, we are the largest provider of homeless services here in the Cape Fear region. As stated, our mission is to feed the hungry, shelter the homeless, and foster transition to housing. On this property, we operate a soup kitchen, provide day and night shelter, connect guests to case management and healthcare, and then help individuals and families move back to permanent housing, and then also provide supportive housing facilities as well throughout the region. We see every day that really like health is deeply connected to whether someone has food, shelter, safety, transportation, medical access, and housing. And food for us often is the first doorway into that overall health care. Someone may come to us first to our soup kitchen, to our dinner, to come and collect groceries from our facility, to find shelter throughout the day. But that first meal can often become a larger conversation with our case managers here that are on site, and then also a medical clinic, which is here on site. This does not happen, certainly, like starting these conversations with the folks who are actively in crisis and in housed and are not at the moment really thinking about their overall health because of Good Shepherd alone. That is only possible, and those conversations are only possible through community partnerships and a system that really exists to make sure that our neighbors are living with dignity and have a great quality of life. Through our Second Helpings food rescue program, Good Shepherd partners, with our local food bank here and grocery stores and our volunteers to rescue about 3,000 pounds of food per day, 7 days a week. And so, through the support of our community and the volunteers that want to support this work, they come in and get Good Shepherd vans. They head out into the community between 9 and 12 a.m. in the morning, and they go and rescue about 3,000 pounds of food 7 days a week that otherwise would have gone to landfills. They bring that food back to the shelter here where that food is sorted by our volunteers. It is redistributed to 14 other more rural food pantries within our region. It is utilized in the approximately 500 meals that are going and being served in our soup kitchen. They also then deliver those meals to seniors and some of our folks who maybe are living in permanent supportive housing and who have been chronically homeless with some pretty challenging disabilities. And so that food that is fresh, it is often produce, it is high quality food, kind of comes to Good Shepherd as the distribution center. And we work together as a community from there to make sure that it gets to the folks who need it. Really, the 500 meals for the men, women, and children staying in our shelter, they also need more support than just that one meal or that one food those few food items that they are picking up. And so that also partners with what we call our grocery giveaway. And so every Wednesday for Good Shepherd, as a no barriers program, there are no questions asked. There is no paperwork to fill out. You are able to pull through the back of our shelter and access a week's full of groceries, a week's car of groceries, and we will serve you as drive-through individuals or walk-ups. And that matters because for us, food insecurity is often one of the first signs that a household is under pressure. If someone is choosing between groceries, rent, and groceries and medication, or groceries and transportation, that is not just a food issue, that is a health issue overall, and that is certainly a housing issue. And then beyond that, it becomes a community stability issue. So our partnerships with grocery stores and our volunteers and staff, composters and donors and funders allow us to do way more than just like serve that meal. They allow us to, reduce waste, improve access to fresh food, and then create a stronger and safety net for folks who are really in one of the more vulnerable parts of their lives. There is, and we know, and everyone knows, there is no quick fix to hunger. There is no quick fix to homelessness, and there is no quick fix to health challenges that come from living in constant instability. But we believe that there are solutions when a community is willing to invest in them and then work together as a collaborative to make solutions possible. For us, nutrition security is a part of a larger continuum of care and services. A meal can lead to trust. It can lead to a conversation. A conversation can lead to case management, a health referral, shelter, housing navigation, or, and when needed, permanent supportive housing. We see this every single day. Someone may come through our doors hungry, but what they are carrying may be a lot heavier than just that current feeling of hunger. They could oftentimes be managing chronic illness. They may be recovering from some sort of trauma, and they may be newly homeless. So, and oftentimes they're a senior living on a fixed income. So our job is not to feed them and then send them on their way. The job really at that point becomes connection to services, connection to other folks and case managers, connection to our on-site medical clinic who is going to be able to assess some of those long-term chronic health issues, who are going to be able to address some of those, small wound care items that potentially turn into large wound care. If not treated appropriately and quickly enough. And so food becomes the entry point for us, but it's certainly not, it doesn't like encapsulate all of the work that Good Shepherd is doing. We just feel like when we feed together, again, we're not just responding to hunger, we're investing in a more stable community. And so that work changes health outcomes for sure, and often begins way before a medical appointment ever happens. It can often begin with just that single meal at the beginning of their journey. That was my
Wow.
pick.
Wow, that was phenomenal, Megan. It's so great to hear, all of the wonderful services and how you guys are using a meal in which to really serve as a gateway and a connector to connect people to other services that can be impactful to them in multiple ways. So to all three of you guys, thank you so much for sharing about your organizations, and we definitely enjoyed hearing about those services. So we are now going to move into our discussion with our panelists. So we have some questions here for you all. And Patrick, I'm going to start with you with our first question. So from your perspective, what are the most significant barriers to health that individuals and families in our community face today?
Yeah, so I would say that the normal ones that all of us are exposed to, so lack of health insurance, it's a very strong barrier, hard to address in this country. Also, the fear for the medical bills that they may receive. And as Dr. Freeman mentioned before, they try alternative ways for treatment. And there is this concept, especially along the Latino population, that if I don't know that I am sick, then I'm healthy.
Yeah.
So it's better not to know that I have some type of problem. If I know, then I recognize and then I need to move forward. And as also Dr. Freeman shows so well, we jump from 2 to 21 prescriptions, medications, and as Jen very well explained on the first part, we are all connected. So we need to take care of what's presenting to us. So access to health insurance and not being afraid of our medical bills or to see a doctor or to do even the blood pressure checks should not be something that will threaten our economic stability. I would add that for the Latino population, the misunderstanding of the cultural nuances that can go beyond statements that Latinos are not like a solid group, that they are all diverse. And that is true, but it's still on the healthcare space, not going beyond just the statement to understand that we must address the Latino population by their nationalities, understanding the data and the national background of each individual. So, for example, in the eating habits, I am Brazilian by place of birth, and I have the first time that I ate a taco or an enchilada or chili beans, it was all in America. We never had any of those foods, and they are compared to Brazilian, to food from Argentina, from Colombia, or from Peru, extremely high in sodium and in other elements that is not part of the comfort food of, for example, other parts of South America or even Central America, like Guatemala or El Salvador. So this increase in the consumption of salt, of sodium in our diets here in the West, and sometimes those are offered by food banks or by the system itself, like Chipotle or other Mexican places or Latino places. These are very huge challenges to address healthy lives for these individuals, and not understanding how this individual was exercising in their country of origin before and how it will impact it here. It's another barrier to provide education and to make concrete changes. For example, for someone from Honduras, a country that it has very high levels of violence, walking in the streets by the end of the day is not something that someone in a normal sanity will do because it's threatening to your safety. So you cannot require that. So that person sometimes have lived 20, 30, 40 years without never exercising at that time. And in most of our communities in the West, not all of them, you can do that. You have the spaces. We still know that there is walkability is a challenge in several of our communities, but overall, we have parks or we have spaces. We have groups, including the American Heart Association supports for active living, where we can go and exercise together. So when we get the culture of what it was before, to understand the individual that is in front of me by their national history through a trauma sensitive perspective related to political environment in their countries and cultural things from where they came, so that makes way easier to put down these barriers to access to health that we have in our communities here. So this is a conversation that I could go for another 90 minutes and give some details and explanations as well. But I would say that in our experience, through Embrace Latino Voices and immigrant communities, so not having health care, not having health insurance, I'm sorry, and being afraid of health care, plus not having like a deep understanding of who are the individuals by their nationalities, not just being Latino or just being Hispanic. So the abolish of these terms, Latino, Hispanic, and dealing with them as a Brazilian, as a Mexican, as a Colombian, as a Honduran, that would be the best things that we could do. And that is what makes, and I will credit that to the success that we have at Embrace. So this breakdown and be able to identify which individual communities are in more vulnerability for high blood pressure, for example, or lack of exercising, empowers the funds that we have to make the most of every single dollar in terms of outcome in healthcare that we are expecting.
Wow, thank you so much, Patrick. What really stuck out with your response there was a trauma-informed approach. And I've been hearing that more and more, especially in talking about barriers and really working to cultivate programs that will be impactful and utilized. And so I do open this question up to our other two panelists, particularly just because you guys both serve in a different lens of intersection and working with individuals. So I definitely will be open to hear if you guys have any other additional perspectives in which to add to what Patrick has enlightened us with.
I would add on to what Patrick has said along the lines on the barrier that your community face, especially when it comes to medical bills or the fear of knowing. So when you don't know, it's better not to address it, because now when you know, what is the next step? That is really a true statement. That is a reality of a lot of people in the community. And in my end, I would definitely say just listening to that makes me realize just the information fatigue, and falling back on the story I shared, because now that you know, where do you start? How do you proceed? And that's what could be a barrier to moving in the right direction. But I think honestly, the best way we as leaders in the communities can help our community move forward in the right way is just making sure that we have actually lowered that barrier of like the judgment, because even when someone approaches you and you help them, connect them with the resources that can help them move forward without the financial burden, still, if they don't trust that there's no judgment there, they might not be able to share everything that they've already seen or what they already think or what they've heard. And that also makes the right information to them. They haven't quite received everything they need to move forward. So lowering that judgment threshold as leaders in the community actually would help our community a lot. So they're able to share all the remedies they've heard about or what they've already tried or what they're thinking, because that allows us to guide them better.
Yeah, I totally agree. I think for us and what I've seen over the past 18 years, it's easy from an outsider's perspective, maybe who's either not in this work or is, just kind of looking from the outside in. It's easy to say, well, there's only like these three things that would help someone stabilize, right? All you've got to do is one, two, and three. For us, it's like if those one, two, and three things are all 6 or 7 miles apart, no one and that individual does not have transportation, that becomes a really huge barrier and something that seems very simple to go get to the doctor for a checkup or whatever falls to the bottom of the list because now you don't have transportation over there, your kid was late getting off the bus, there's 100 other things happening, and so that appointment gets passed by. I think for us, having everything in one location on one site, you're going to have access to a case manager who's going to be able to help you track down documents and IDs and birth certificates. You're going to be able to access that medical clinic. And then we're also going to make sure that with volunteer and staff, those relationships, to everyone's point, start to build trust so that there's a trust built up there to where you will trust someone for transportation and can rely on a case manager to get you to doctor's appointments that you need to go to. And so I agree, trust is a barrier and that's something you've got to overcome, fairly overcome. And then transportation is always, I think, a barrier whenever you don't have transportation. And so just trying to, as a community, put services that are related, close together or have organizations that are willing to help provide transportation to some of those places.
Thank you, Dr. Freeman, and thank you, Megan, for your additional insights into that question. And I think, Megan, your response in regards to talking about, working on methods in which to address those barriers, particularly transportation and, community partners joining in to help you guys address some of those barriers, leads into, it has a perfect segue into our next question, which is which community partners have been most impactful in advancing health and why have those partnerships worked well? And actually, Megan, I'm going to start with you, just because you provided, like I said, a perfect segue into that. So which community partnerships do you guys value the most and have been most impactful in helping you all to advance health?
I love this question because I really feel like this is a good blueprint. I want all communities to think of it from this perspective because I don't think that there is one partner that is actually more valuable than another one for Good Shepherd Center. Our partnership with Cape Fear Clinic and having a medical clinic on site is critical for a variety of reasons. People have been exposed, they're sleeping outside, they're sleeping in their cars, they're facing chronic illness, mental health challenges. And so that connection to what they're able to provide for folks who are in crisis is absolutely critical. At the same time, our volunteers who are coming from churches, from the business community, recently retired individuals who are coming to rescue 3,000 pounds of food per day, 7 days a week, is absolutely critical to this work because we cannot supply 500 meals a day in a soup kitchen without their willingness to go out and rescue that food and bring that back and sort it and redistribute it to other food pantries. Businesses who are coming in the evening and who are sorting that food and then cooking that food and preparing that dinner are also critical because without that, our 110 men, women, and children who are here in the shelter aren't getting the supplements that they need to heal and return to health. The food and grocery stores and food bank partnerships that we have, without them, we would not have any of the food to go and rescue. And so then I would say with our case managers, the partnerships with local landlords. Hey, are you willing to rent to this individual? They have case management. We're willing to help with putting money down for 10 months less rent or helping with security deposits. You should want to rent to my family or individual because they have case management support. So if you need anything, you can call direct to me and we'll help take care of that. I think my message always when it comes to something like what we're trying to achieve in the Cape Fear region at Good Shepherd with the partnerships of many is that there is no one single thing that makes this work possible. There is no one single entity that can make this work possible without a community as a whole agreeing that we want to invest in solving this long term and that we want to invest in working as a community to make it a better place to live for everyone who calls this place home. These things are not as successful. And so all of the partnerships are critical. All of the partnerships are strong, and all of those partnerships are rooted in long-term, we've been around for 40 years. So some of our volunteers have been here for 30 years, but it's a long-term commitment as a community to make this place that we call home better for everyone. And one shelter is not going to do that. A soup kitchen alone is not going to do that. Food rescue alone is not going to do that. A medical clinic alone is not going to be able to do that. But when we are able to partner and work together as a system to provide the needs for folks who find themselves in temporary crisis, then you see real long-term solutions and a community really start to change the mindset of what stability looks like for everyone and what health looks like for everyone and what a great quality of life looks like for everyone.
Thank you so much for that. As we say, it truly always takes a village. And so I definitely welcome Patrick and Dr. Freeman to describe their community partnerships. I know some of them are pretty core with volunteers, the local food partners in which we work with, but are there any others, Patrick and Dr. Freeman, in which you guys can call out from different sectors in which you guys work with as well?
I mean, I'll have to add on to Megan, and you're right. There's no one community partner that's it. With us, no one really should be working in silos. It should be all together. For us, we are an independent community pharmacy. We are for profit. But the thing is, we're very accessible. So even when we have our community members come through, there's no real gatekeeper like that. The door is always opening and closing. We have a list of resources around the community from nonprofit to for-profit. So when patients come in and tell us their concerns, we always have to give them the options of what next or where to connect them with, because these are people in the community that have been doing the work, and we can actually vet for them. And just knowing those people and presenting it to our members makes it easier for them to choose which direction to go, because again, no single person has the same, everyone is different financially with their own burden, everyone is different. So having options to connect the patients or the community members to the resources around the community is what we do. And we just keep a running list and add and remove as we go.
Yes. My case is the same, and Megan, I believe that she spoke it all. It's hard to address just one that we can name over here. So I will divide in three areas. So the administrative partners, such like the American Heart Association, Atrium Health, Novant Health, Blue Cross Blue Shield of North Carolina, Microsoft, Allstate Insurance, American Airlines. So those are the partners, especially at this moment when the funding to our organizations in the federal level have changed a lot. So, and when heartbroken, I saw so many sister organizations closing their doors to the community. So those are the ones that help us to stay alive. So beside the administrative partnerships, I also have community partners, and those are the volunteers. So I would say that I could name a lot of people, but the volunteers from the community and many of the times, and that makes me a little bit proud. But to see people that come to receive services with us, and after a couple of weeks or months, they return in gratitude to offer their hands and their hours to others. So they have the most of my heart, and I believe that they are very important partners for success of what we do. But if I could name one and not stay, we say in the top of the wall, as we say in Brazil, I will point to one side. I would say that the most important partnership that I have are the community members that most of the time I don't know them, but they are present, for example, in WhatsApp groups. So WhatsApp is an app for communication and messaging. It's very popular among Latinos, and they just share and they talk, they give testimonies, sometimes saying about the health screenings that we are having, vaccinations that we are having, the activities that we are having. And those are the people that help us to spread our arms into the community.
Thank you guys so much. It's always, like I said, great to hear in regards to the villages that make up the work in which we are doing in the community, and in knowing that it takes a diversity of those partners in which to move us forward. But Patrick, to your point, you said something very powerful with your last pillar of partnerships, and that is actually the community within itself, those that are utilizing the services and the resources in which you guys, work so hard to structure and to place out there. And so with that, with those services and getting to know the community, what small health behaviors from Life's Essential 8, with the health behaviors that Kat and Jen went over, particularly around knowing your numbers, getting enough sleep, the physical activity, and just the health behavioral component seem to resonate most with people that you serve? And then in particular, how do you tailor these services and the messages from them when time is limited or resources are constrained? And I'm going to start this question off with Dr. Freeman.
Well, what small health behaviors from Life Essentials that resonate most with my community? I definitely would say knowing your numbers, because I feel people feel more control of their health when they actually know their numbers. And when they're on their own driver's seats, it helps them. So a lot of them would come to look for those numbers when something is off, because eventually they have to listen to themselves and say, okay, let me go check the blood pressure because I'm not sure why I keep getting this headache. I've taken all the over-the-counter ibuprofen, whatnot, but what is going on? So looking for a way to be in the driver's seat is definitely the one that resonates the most. But I have to say, though, everyone is different, because when they do come through, and it comes down to what's more, there's 8 of them. And when the time is limited, we just have to focus on which one is more critical for you at this time. Is it sleep? Is it your blood sugar? What is it? And phrasing it in a way that's not to lecture them on all 8 is the way we approach it. So instead of we tell them the why, like, why do you even care? Like, why do you want to fix this? Is it so you can feel more energetic? Or is it just so you can have more clarity? What is it? So focusing on their why is the way we approach it, better than that this is what you need to do. Because understanding their why and tailoring it towards their why makes it easier for them to embrace and work on. And sometimes time is a problem, with limited time. But how I try to do it is always give the 30 seconds, even if it's just 1 minute that you have, give half of it to listen on. And then once that 30 seconds up, then you can then use the 30 seconds to help them or guide them in the next steps. And that way the patient also feels heard, instead of just telling them what to do and giving them the flat handouts, saying, okay, well, I'll see you later. So that's how we approach it. And everyone is different, but definitely the one that resonates the most is knowing your numbers, particularly blood pressure monitoring, because that's something they can do here. And if it's a trend that we're seeing, That's when we advise them or provide a monitor for them to then do that at home, track it, and connect them with a resource or a clinic, maybe a mobile clinic or FQHC, to follow up with their provider if they don't have one.
Thank you so much for that, Dr. Freeman. Megan or Patrick, or would you guys like to chime in on any ways in which you guys tailor these messages? And what are you seeing as the most prominent small health behaviors in which you all are working to educate your population about, but then those that seem to resonate the most amongst them as well?
I think we're focusing a lot on sleep. If you are coming from an unhoused situation and you are in an encampment or in a car, those who, for practical reasons and safety reasons, are not great places to sleep, and so you are in a constant state of fight or flight, and survival mode, which is put a lot of anxiety, a lot of stress on the body and on the mind. If you're someone who is working through some mental health challenges, lack of sleep, and living in that type of fight or flight mode can make those conditions a lot worse. And so I think for us, when you first arrive at Good Shepherd Center, getting a stable meal to try and get things to calm down in the body, and then a place to sleep that is safe, that you're not going to have to worry about someone coming maybe to take your things or your personal safety, just trying to get back and decompress to sleep during regular hours and creating some sort of consistency within sleep so that you're able to think through some of the bigger health, maybe challenges that you're facing. And you can even start to consider something like housing, which is going to help your overall health, obviously in like a really huge way.
Absolutely, Megan. And so we actually talk about stress as well, and how that impacts the body. So interesting in which you were talking about sleep and the correlation with stress, and then its overall tie into heart health. And then Patrick, I'm gonna leave you to take us on out with the behaviors in which you guys focus on and seem to resonate the most, and then how you tailor those messages at Embrace All Latino Voices.
Yes, so I would say that the small ad action that we had 2 years ago, establishing the blood pressure station, and every single person that enters our office, they get that checked, and we take the time to explain like the new guidances and the new tires for the heart blood pressure, and also how they can use and the reason why we are doing that. When, for example, in Mecklenburg, where the headquarters of Embrace is located, the Latinos were the number one ethnical group dying of heart diseases, and heart diseases were the number one reason of death in our county. So explaining to them that the risk is way closer than they think, that I don't know if by fear or by surprise, but I believe it's by empowerment, that it's way cheaper to just sit and talk to a community health worker than receiving the medical bill later on when we ignore that. So we see that they pay attention. The second or third time that they come to the office, they go directly to that, and they celebrate when they are changes or if their blood pressure is normal. So I think that when we come from a place where we don't know anything about it and they can identify the numbers, that is a huge win to my community. A second one, and that is one of my favorites personally, it's the food and nutrition education pieces that we have, especially with the youth. We treat food insecurity and nutrition insecurity as two different things that embrace. So making sure that they have access to food, to something to eat, it's extremely important to us. But to the Latino communities, as I mentioned in the very early in this call, so providing food that match their comfort food, the national habits that they have in their countries, and sometimes even in the area, for example, in Mexico, like in some areas they eat differently. It's not the same type of food like it is in America. So I had very disappointed experience a few months ago when I went north and they didn't have sweet tea and coleslaw. So how? How is that? So in the same way that we have different foods in different areas of America, that happens in Latin America as well. So, uh, and I'm mentioning the food and nutrition insecurity with the youth because it's where we are seeing the biggest change family-wise. So, and how I tailor, especially when resources are constrained, it's to mix funds from different grantors and partners and put and connect things together. And for example, we have a partnership with Food Lion, and they provide gift cards to our community. So we give those gift cards to the community, to the ones that participate in the food and nutrition educational session. That is less than an hour, and they receive food as well. And after they learn how to shop, for example, in a budget, so how you can eat healthy or eat in the best way with $50 and go to the supermarket with $50. So I believe that most of us know the big challenge that it is, $50 and buy things even for 3 days to feed a family of four. But we do that in a peer support way. So we can add the partnership that I have with Food Lion, the content from the American Heart Association and the American Diabetes Association into one program mixed. And then we go with peer support to the supermarket. And when we go there, we see the kids like telling their moms, let's get fruits. Let me get like raspberries. Let me get dragon fruit. And for many of them, like eating like raspberries is a luxury because it's a more expensive fruit. It's the first time that they're eating dragon fruit. It's something that they only see on Starbucks commercials or on YouTube videos. And then suddenly they can. And when they choose that instead of chips or instead of other processed foods or so on, I see that as a huge win as well to our communities overall, because these health changes, and this is something that we stress to them, this has an impact in your long life health, but also financially to you right now, because it still is way cheaper to do this change, to exercise, to eat healthy at a local grocery store instead of a gas station or a dollar store, than receiving the medical bill and not being able to provide to a family or being there present. And I believe that these two programs from the Life Essentials 8 are the ones that I would highlight as the more impactful to the community and that makes Embrace Smile as well.
Wow. Thank you guys so much. Definitely have appreciated hearing about your organizations, the services in which you guys are offering, and the great work in which you're doing in the community. It's been phenomenal to hear about the impact and how you guys continue to drive it and how you have those diverse partnerships in which to drive those relationships. As well as you all providing practical ways to us and to the audience on how to build trust, how to address different delineations of our populations in which we're serving, as well as to promote those healthy behaviors and to resonate with the populations that we serve for true utilization of those services. So thank you guys for your time. That concludes our panel discussion. I'm now going to turn it back over to Allison for Q&A and to conclude us.
Thank you. Wow, just some practical tips from Embrace All Latina Voices, Southside Discount Pharmacy, and Good Shepherd Center. Before we take a poll, we have an opportunity for you all to use the Q&A box to ask questions of the panel. That was a lot of information that was shared. I thought it was great myself just to listen and hear the intertwining of the aspects of Life Essentials 8 along with the services you provide. So if there are any questions, we have a few minutes for you to type those into the Q&A box and our panelists can respond. We will again share a follow-up email email if any of the questions are not answered, and we will also share our slides. So, while you're working on some questions, I wanted to do a quick poll, and you can add your answers to the chat. So, first question, which of the Life Essentials 8 healthy behavior and health factors will you as an individual work to improve in the next 6 months? So you can see those listed here. We have the 4 health behaviors and then the 4 health targets. So go ahead and select. Okay, I'm not seeing where the answers are.
I can end the poll so you can see it. Just let me
All
know
right.
if you feel like
Go
we've had enough time.
Yeah, I think so. Go ahead and end that. All right. You all should be able to see these are the health behaviors and health factors that you would like to improve in the next 6 months. So looks like we have healthy diet and physical activity kind of leading the way, but some of the other health behaviors are not far behind that. So I appreciate the honesty. And if anything, this is for you to go back and reflect after this webinar on ways and tips and tricks that you can do to work on your own. All right, next question. Would you as an organization commit to incorporate Life Essential 8 materials into your work? So we talked just a minute ago about you as an individual. Now I'd like to see how you as an organization can incorporate those Life Essential 8 materials. Yes or no? And Michael, we can go ahead and close that again. All right. So we got 100% of you said that you would like to incorporate those in the next 6 months. Perfect. So I'd like to now move into how you can do that as the next part of our call to action. So stay with me for the next 10 minutes. I'm going to give you the tool part of our conversation today of how to actually do some of the call to action. Next slide. All right, so Kat and Jen talked a lot about Life Essentials 8. We gave you a ton of information. I would like to make this accessible to you to use in your organization and then also for you and your family. So we have on the left side of the screen the Life Essentials 8 QR code. It is available in English, Spanish, Life Essential 8 for women, pregnancy, and kids. There's also a quiz that you're able to take on the Life Essentials 8 homepage. So I encourage you all to do that and possibly use that within your community-based organizations. And then if you want any handouts or resources to print, there are plenty of those infographics that you see on the right side of the page that you are able to print and download from the Life Essentials 8 homepage. Encourage you to do that. And then if that wasn't enough, because American Heart Association is a wealth of science-based information, we have what's called Empowered to Serve. It is 18 science-based toolkits that cover everything from health education to community advocacy and to real life stories. So I encourage you to look at this website. Again, the slides will be shared so you can do the link there, but you can also just Google Empowered to Serve and you'll come up with those toolkits, stories, and different advocacy avenues to explore. On the right side of the page, you see Healthy for Good, which is tips on healthy eating, moving more, getting enough sleep, and reducing stress. There's also a huge recipe catalog in there for you to share, and then also for you to use individually with yourself and your family to feed healthy foods. Next slide, please. All right, so as this call to action, we wanted to truly make sure that you are prepared to think through ways to utilize this in your work. What I wanted to call out is that the Life Essentials 8 and some of the practical tips that our panel shared are really used as conversation starters. So just taking back all of this information, you can kind of utilize that in the ways that you work. Some ideas we have on screen here is if you are working in the food access and nutrition programming, you can do this with Life Essentials 8 handout. In a food pantry distribution, you can provide some of those recipes from Healthy for Good. Also, any time of cooking demos. And then going down the page, we see the physical activity and wellness programs. Lots of infographics that we can use. They are translated into different languages. You can use them with seniors, youth, faith-based organizations. On the top right of the screen, you see navigating and case management and outreach. So Life Essentials 8 self-check can be utilized in any type of community setting or clinical setting. Again, the Life Essentials 8 is not meant to replace seeing a practitioner, but meant to give important information so that you can use that when they do see the practitioner. And we also kind of like to do, I think at the end of the Life Essentials 8 slide deck, there was a really important infographic that it all kind of flows together, and you could do one thing at a time to build on those healthy behaviors. There is a Life Essentials 8 that we can use as a screening and referral tool for different health organizations. We provide screening recommendations and referral recommendations. And then finally at the bottom, we have ways to advocate for smoke-free housing or smoke-free facility policies, safe walking routes, or how to use shared spaces like a gym at the church could be used by an after-school program. That's another idea. And then healthy food procurement at community sites. These are all resources within the American Heart Association website. So hopefully you can take away one of these resources as a call to action. Next slide, please. All right, so again, I know we've covered a lot. You've seen a lot from our distinguished panels. I sincerely appreciate your time today, joining the webinar, listening and learning. One of the things that is really important to me is that we all are professionals and we all have personal lives. And so hopefully these ideas, knowledge, and resources can be used in both aspects of our lives. And remember, change doesn't happen all at once. It happens one conversation and one choice at a time, and it really starts with us. Thank you again to our sponsor of Novant Health, our American Heart Association speakers, and the community-based organizations playing a part in their expertise on these topics. It's time to close the discussion. However, again, please utilize the Q&A box for any kind of questions that you may have. Thank you and have a great rest of the day. Bye-bye.
Thank you very much, everyone. Bye-bye.
Oh, thank you. Great
Thank you,
job,
Patrick.
everybody.
Great
Yeah.
job. All right. Recording.